All right. I think we can surely start. We are already live streaming on Facebook, and I would very much like to welcome you to our second part of our discussion series on the topic 1 year after COVID. Today, we are going to talk about global citizenship, an alternative to vaccination nationalism. And I'm very happy to welcome Mr. Markus Bachmann. He is Advocacy and Humanitarian Affairs representative from Doctors Without Borders, now stationed in Vienna, but with a broad experience also in many different countries in Africa, but also in the East. So thank you very much for joining, and I'm happy that you found time.
Thank you very much for the invitation. I'm happy to be here.
Thank you. I would also like to welcome Hannes Swoboda. He is the president of the International Institute for Peace and also president of the Sir Ustinov Institute, which is our cooperation partner in this whole series. So also my thank you, of course, to the Ustinov Institute. And I think we can already then go a little bit more into the discussion. And we have been talking also beforehand that actually the results of the COVID-19 pandemic really show the vulnerability in Europe, but of the whole world. I mean, we saw the decline in economy, but also with huge effects when it comes to socioeconomic welfare and well-being of all the people around the world. So what we can also observe is that these inequalities already have been existing beforehand, but the pandemic really they aggravated it, and we have now a situation where we do not really know how to deal with it. We have, on the one hand, we had this nationalistic approach in the beginning of the pandemic where we tried to save like most of the vaccines for our own nation states. I mean, the European Union then came to some agreement, but of course we did not really care that much about what happens with the other parts of the world, the so-called South. And we are thinking now, and we'll try to address also other concepts, like, for example, global citizenship. Could these be an alternative to vaccination nationalism? How to overcome these inequalities will be a question of the future to come, and what role the United Nations, the WHO, but all other international, but also national actors can play is one of the big questions we will try to address. I would start, and I would suggest that also for our participants that you can also, of course, post the questions already while we are discussing. I will go through them when we are talking, and we'll post them directly to the person you asked, or just like put it in the room for a discussion. We will have around 45 minutes up to 1 hour, and I look forward with the first question right now, which is like more of a basic one, but it is discussed all the time. But the question is, do we now have sufficient vaccination? How unequal is the distribution worldwide? Why is it so? And do really pharma industry, does it play a big role in this? Maybe Mr. Bachmann, you can already start. Yeah.
Thank you very much for the question. I think it's a very clear and a very simple answer. No, we don't have sufficient vaccination, and the distribution is not equitable. There's absolutely not enough access for people living in the so-called global south. Not wanting to go too much into figures, we have just passed 5 billion doses of COVID-19 vaccines administered worldwide these days, the day before yesterday. And out of these 5 billion doses administered, only about 92 million doses have been administered on the African continent. I just take the continent as an example. And there's, of course, way more low and low middle income countries on this planet, and not confined to the African continent. But 92 million doses, only out of 5 billion doses, went to Africa. And if we take aside the Maghreb states, the Northern African states, and the leading state with more than 30 million doses administered in Morocco, only 44 million doses have been administered in sub-Saharan Africa, meaning that out of the worldwide administered doses, a super tiny fraction was accessible for people in sub-Saharan Africa. The reason is there's not enough doses. The answer is a very crystal clear one. We all hear about the the concept of herd immunity. We need to reach to cover 80 to 85% of the population. So we can make very easily the mathematics. We would need at least in a dimension of 15 billion doses to reach that. We have now 5 billion doses at hand, 9 months into the vaccination drives worldwide. We don't have enough vaccines because not all the vaccine production capacity is utilized for it. We have a paradoxon. We don't have enough doses, obviously. And these doses could be produced, way more doses could be produced, but the holders of the intellectual property rights are sitting in the global north. It's a handful pharmaceutical companies, and they are not willing to share their know-how in one way or the other with production sites, manufacturing sites in the global south. The obstacle in between, that's the intellectual property rights, which prevent a wider use of this know-how to use the production. Something we cannot afford in a global crisis, in such a disruptive crisis as the COVID-19 pandemic.
Thank you very much, Mr. Bachmann. Hannes, maybe following up on that, because I remember you have also been writing about this whole issue with the intellectual property law, intellectual property rights, patent laws. Would actually, if we would be able to lift them, would you think that this would then make the situation better, or that then the production could be, I don't know, like doubled, tripled in a short period of time? So what is your suggestion?
Well, first of all, I will come to that immediately to underline again what Mr. Bachmann said, to the figures. These somewhat more than 5 billion doses, 32.9 or nearly 33% of the world population has received at least one dose, and nearly 25% of the world population is fully vaccinated. But only 1.4% of people in low-income countries have received at least one dose. So Bachmann spoke about Africa. Africa is, of course, the best example. There are some few countries, low-income countries, who are relatively well-deserved. But overall, only 1.4% of low-income people have received the dose. Now, what to do? Of course, there are two ways how to spread more the vaccines. Of course, to produce more overall, and of course, to lift the property rights and to give licenses. Now, the argument, and there is some reason to believe that the argument is not wrong as such, for the companies, is that it is not as easy to produce, especially the vaccines concerning COVID-19, because you have to have many products, many high, of course, levels of health security and carefulness you need to produce. So it will not be easy just to open it up. And of course, the second thing would be to give license, which as such would be easy, that you have to give the license, so enforced license, but the process is very complicated. What we need, of course, is, first of all, a much more easy way to give licenses to the other companies who want to produce it. Nevertheless, it will be very difficult. But what we see overall, and I think this is the major element, is that the production is concentrated in the US, in Europe, China, Russia. It was also, and is still concentrated a bit in India. But you saw already in India that India, who was ready and was planned to spend a lot of vaccines to other countries via the so-called COVAX system, we will come to that, I think, later, stopped any export because they had difficulty at home, at least. So what is, maybe this opening of the property rights is good, but I doubt that it really would bring an immediate result. In the medium term and long term, yes. But what is necessary is to have production capacity. Only some countries in Africa now start. South Africa is one of the first. Others have the difficulties. Of course, you are also, we will come to that later, but Mr. Bachmann is more expert on it, on the question of distribution, because even the distribution of the vaccine, some of the countries get is very, very difficult. But I think the major orientation must be, it is not acceptable in this world that you have the production capacity of vaccines in general, and especially COVID vaccine, is concentrated on the rich countries. And of course, we see it in Austria. It is not easy for a prime minister, minister, whatever, in Austria or Germany, whatever, to say, well, we get not so much vaccines, we export some of it outside. But if you don't have the production capacity outside, in Africa, in Asia, in Latin America, we will always have this very dreadful situation. So I'm a bit doubtful that this lifting of the vaccines, and interestingly, America did not export. They had a de facto prevented any kind of export, but then they were all of a sudden opening for the property rights, as they have a lot of it produced. It is a bit of fake position, has it been. Nevertheless, I'm not against it, but I doubt that it will be very helpful. But what we need is to establish production capacity in all the countries around the globe, not in all the individual countries, but all the continents, because otherwise we will have that dreadful and terrible situation we still have today, especially in Africa.
Maybe if I just may quickly complement, we were looking into that as Doctors Without Borders, and there's a bit of a myth that in the Global South there's no capacity, and I'm not talking only about the manufacturing capacity, but also the intellectual capacity to manufacture a complex biological product like the new generation of the COVID-19 vaccines. But there is. There's at least seven countries in the Global South which very quickly could adapt their existing manufacturing capacities, because putting a new plant out on from zero will take you years. That's correct. But there is capacity, and the capacity includes skilled personnel, established processes, including regulatory authorities, because you always need the manufacturer and the overseeing authorities. They are in place in South Africa, in Egypt, in Tunisia, in Morocco, in Thailand, in Vietnam. And the pity is that in a situation where we have a shortage of production manufacturing capacity, we are not able to use that. The so-called TRIPS waiver, a proposal of the governments of South Africa and India to suspend intellectual property rights for COVID-19 tools, not only for vaccines, but also therapeutics, diagnostics, including ventilators and oxygen concentrators, which are really, truly life-saving in the COVID-19 pandemic, is supported by Doctors Without Borders, because this would, on the short term, really boost the production capacity. And I think that the United States, which is normally not prone to interfere with economy, they also acknowledge that the impact of not tackling the pandemic, not providing the vaccines as one of the elements to combat the pandemic, will not only cost billions of dollars, but it also costs a lot of lives. And I just want to go back. As we speak, every day, in average, 10,000 people documentedly die of COVID-19 worldwide, 10,000 people. And we know that COVID-19 vaccines are very effective to prevent severe and critical courses of the disease and a potential loss of lives. What we see is that dramatically there's a shift of the loss of lives from the global north to the south. Because as you mentioned, Mr. Swoboda, the global north vaccination coverage is improving, it's moving forward. Some countries have a good coverage, and we see a dramatic decrease in mortality rates. we, as Doctors Without Borders, in our countries of operations, like let me mention a terrible third wave in Yemen. It's really a killing disease in Yemen. It's a killing disease in Myanmar as we speak. Tunisia just came out of a terrible third peak these weeks. So we must be aware as we speak that the mortality rate due to COVID-19 is dramatically high in many countries of the global south, and it will remain high and become high again in many other countries.
Well, if I just may respond directly, I agree. What the European countries should have done, I mean, China was also not very, very helpful, would have been to say either you give, you suspend, we suspend and we agree with the suspension of the property rights, or you come to an immediate agreement with these companies you mentioned, because these are the countries where we have the facilities, to produce in these countries, together with these companies, the vaccines. That didn't happen, and that I think is the bad thing, that the European countries did not try to find a way out if they have that kind of, let's say, hesitant on the property rights. But this didn't happen, and therefore the non-solution we have now is the worst situation we can have. And here Europe should have been much more helpful.
Thank you. I think you mentioned many very important things, and since we're talking about a pandemic, I think we should not forget that the pandemic is a global issue, and a global issue can only be tackled globally. So my question would be, why is there not really a global strategy when it comes to the pandemic and the vaccination? It is not really there. I mean, there are some intents, there are some incentives. I mean, there is the COVAX initiative, which can be seen a little bit like a part of a global strategy, but in the end, the global strategy is lacking. What could be the preconditions of actually setting up a global strategy, and who could be the actors, and who are the spoilers? Mr. Bachmann, what is your opinion on that?
I would first ask, do we have, for example, global health strategies in other areas? Do we have global public health strategies or humanitarian developmental strategies? And if we do them, if we have them theoretically, kind of as a strategy formulated, how much instruments, platforms do we have to really roll them out globally, truly globally? And I think this is one of the challenges we see, and such a disruptive crisis, not only a health crisis or public health crisis like the COVID-19 pandemic. It's a societal, it's an economic, it's a massive economic crisis. And the indirect consequences of the pandemic, the economic consequences on people's lives and their coping and their livelihoods maybe costs more lives than the direct health impact. And I think this really reminds us that we need to work on these platforms for rolling out, implementing global strategies. Let me just go back one step. We all had this commitments of the global north, and let's talk about the European Union member states. We will truly globally act and act in solidarity, and we will ensure equitable access to COVID-19 tools. And what happened? The European Union was among the first blocs or countries to secure COVID-19 vaccines exclusively. The European Union, meanwhile, could 6 times immunize its population, while many people in the global south have still no access to COVID-19 vaccines at all. So I think this is a really big wake-up call to look into the governance systems and to look into how we can move forward. What are answers to it? I think it's transparency and accountability. I think there's now a lot of rhetorics. Mr. Swoboda, you mentioned that the US were effectively banning the exportation of vaccines, or the European Union was very strongly limiting the exportation of vaccines. At the same time, talking about global solidarity and it's combating the COVID-19 pandemic needs to be on a global level. I think we need clear accountability so that this doublespeak becomes very tangible and very clear, and that the accountability is not only to the local populations. I found it very interesting that ethical boards, ethical review boards, very early on came out with recommendations about how to prioritize or rationalize the use of COVID-19 vaccines, because it became very clear they will be too limited. They are not at hand for all people who need it. And for the first time also in our rich countries, we were confronted with the situation we need to ration a high demand product. All these ethical considerations about priority groups, why it's ethically acceptable to prioritize certain groups and others have to wait, including economic impact on these populations, all that was thought nationally, on national levels. Very smart and very holistic and complete considerations of the Austrian board, of the German board. I have looked into many of these board recommendations. I have not found a single mentioning about a global perspective of ethical considerations for the distribution. And I think this could be a good starting point to have a strong base and also a strong reference point where we can hold decision makers and politicians and state leaders accountable, that they are accountable not only to their own populations, obviously they are, and that's clear, but that they are also accountable in a global dimension. In the end, also to the benefit of their home populations.
I agree. Hannes, what do you say to accountability and transparency, but also ethical considerations on a global level should be important? And since the European Union was mentioned, we all know and we promote it very often that the European Union is based on European values, and they would actually include such an approach. So what do you think? What can we do in this context? Like, I don't know, this solidarity versus nationalism. How can we foster this?
Well, first of all, I want to start where Mr. Bachmann started. Health is very often talked about, but it's not on the priority of global public policy. Look at the WHO. We all thought, me included, it's a UN organization. But de facto, if you look to the finance, much finance is coming from private foundations, which is crazy that you have a UN organization and so much on financed by private organizations, like, for example, the Bill Gates and Bill and Melinda Gates Foundation at that time. This is also one element which is leading to these kind of fake news and fantasies people have that the whole vaccination process is something in the interest and invented by Bill and Melinda Gates. Now, I met both of them several times, and I think they have a very sincere program. But that so much is dependent on this kind of private financing is crazy. Now, it's different to the Doctors Without Borders, because they are actively, and they are not the rich guys who do the work, but they are ordinary doctors who just want to help. So the first element would be to have a World Health Organization, which is strongly publicly financed and is strongly organized and on higher priority of any kind of global policy. Second, now to the question of solidarity. Again, you know, if this vaccination production would be so easy, here a bit disagree with Mr. Bachmann, but we have to disagree on some elements in this discussion, then most of the companies would have produced more for the rich countries. But even here we have strong limitations. And I don't think only of economic reasons, because they could earn a lot of money. People would have paid more in time when they saw the catastrophic situation. First of all, it's a disaster that even in Europe, it was not based strongly on solidarity. Yes, there was some solidarity, but even here, some people said, why did you do it? Why the EU? You should have gone for yourself. To the Austrians, I could say, yeah, good luck. If they have Germany and France and the big countries, they would have taken all of it. So even it was difficult inside European Union to fight for more, let's say, equal distribution. This is the one element. The second element, again, if the production is concentrated on some companies in more or less in the rich countries and in China and Russia, so anyway, more or less richer countries, it will always be a disaster. You have to shift the production into the poorer countries. And here Mr. Bachmann is totally correct. There is knowledge in these countries. There's also some capacity. It's not easy now to get all the inputs into the countries, but this must be the major concern. You cannot make it that all these countries are dependent on technologies and know-how and property rights from the richer countries. There has to be a rebalance. Otherwise, it will not function. To rely on solidarity, to demand from some politicians in Austria or Germany to say, you don't get a vaccine because we have to send it somewhere else, will not work. I think the major element is that the structural change has to be here, has to be promoted. Here, some of the countries, I would say, are much too soft with us, because they should push much more and demand much more help in the direction of building up their own capacity, because even the Serum Institute in India, which is producing, is not able alone to do all the vaccines for India. So, and we demanded, or COVAX depended on export from India to other countries, from one poor country to another, maybe even more poor country, instead of saying the production capacity from the rich countries has to be delivered and has to be shifted to, or at least added in the poorer countries. So I think this is the only chance to get a real solidarity, and that only will come if we say that the international organization, which is responsible for health, has to have much more power, much more influence, and they have to build up the structures for more equalized production, not only, of course, of vaccines. There are many other issues, many other products which are not available in poorer countries or are only available to higher price. And this is the last point. It's also the price. If you look what some poorer countries have to pay much more than some of the richer countries, which is absolutely unacceptable, that in poorer countries you have to pay more for the same vaccine than some people in the richer countries, only because richer countries have a stronger negotiation power. That's, again, a very strong discrimination of the poorer countries.
Maybe if I may briefly complement, talking about ways forward, and you mentioned the World Health Organization and its finances, and it's about the governance, of course, and it's one of the criticisms of Doctors Without Borders on the World Health Organization and the so-called COVAX facility. We will talk about that, I guess, in a bit in more detail. The interesting thing is that you mentioned the financing, where do the financial resources come from, and they dominate the governance. They dominate very much the strategies. It's one of the recurrent asks of Doctors Without Borders that governments of the Global South, representatives of the populations of the Global South, are better and more more strongly represented in these international bodies, including World Health Organization. It's very paradox that in the COVAX facility, you have hardly any representatives of the Global South deciding about the procurement, about the prioritization, who gets the vaccines. Isn't that paradoxical? That actually, if you may say that the upstream part is dominating, and that's where the money comes from, and the downstream part, the people who actually depend on the effectiveness and efficiency of this and this is the only multinational platform we have to govern health and public health worldwide, that they are so underrepresented. And that's what you mentioned, and I can only fully agree, and this is another criticism of Doctors Without Borders. Only 1% of the continent's needs in vaccines, and I'm talking not about COVID-19 vaccines, but all the vaccines for vaccine-preventable diseases needed on the African continent, only 1% are produced there. One of the consequences, if you are not in any control of manufacturing production capacities of the quantities produced, is that it's extremely difficult for you to most effectively and efficiently use the vaccines if you just depend on donations. Let's think all this bilateral and it's in the topic of this debate is the vaccine nationalism. It's based not on needs, that the ones who need it mostly get prioritized. It's based on relations, on deals, on counter deals, and this is one of the fatal errors in the system, which costs preventatively tens of thousands, hundreds of thousands, millions of lives. And I just want to remind the HIV/AIDS pandemic, another pandemic which is not finished yet. In our minds, it's finished because in the global north, it became a chronic disease. But for millions of people in the global south, it's still a pandemic. And we have been losing millions and millions of people's lives due to AIDS in the global south. And we cannot replicate such a disaster of a loss of lives. We need to learn from this disaster of the HIV/AIDS pandemic. And actually, this is one of the strong reference points where we can also have some positive takeouts. What has worked there with painful work to get there, and what can we learn for COVID-19 pandemic?
Thank you. Hannes, would you like to add something on that? Or?
No, I think I fully agree. There's total agreement.
Yeah. To make up maybe another topic, I mean, you mentioned it already, is this COVAX initiative. And I would also like to draw upon your experience since you're here and you have been working in the Global South for many times, and you just recently also have been in Nigeria. And my question is, when you're there in the countries, like how do you perceive the national or regional vaccination strategy? Like this would be like one of the questions. Maybe you can just tell us a little bit from your experience, what is important there? What are the big challenges? How do you address like the problem of rural areas? Is there access at all? What about the personnel in hospitals, etc.? Like all those questions, which I think we are not discussing in the West anymore, since we are more or less, we have the vaccine and people are not really dying that much, even though numbers are rising. And I think it's very important that people are still dying and that the pandemic is not over. So, and then there is a question like, is there something similar, like for example, in Africa, is there like a regional approach towards setting up an initiative like COVAX or similar to COVAX or something similar? Yeah.
I think just maybe starting with your last question, there is the African Union set up the so-called AVAT mechanism. It's a pooled procurement mechanism for the African countries which are interested to pool the procurement of vaccines, and with financing by the World Bank and technical support by UNICEF, the African Union set up this mechanism parallel to the COVAX mechanism for African countries, and it works well. It also addresses one point Mr. Swoboda has mentioned: the purchase power, the bargaining, the negotiation power. If you pool your procurement, your purchases, you have a better chance to get better prices. And it's for me a very promising example of ownership. A continent is taking ownership. It's building the platform. It's the first time that anything like this has been established on the African continent, and it's making very good progress. And one of the beauties of these elements is that, of course, the 55 members are very strongly represented also in the governance structure of this mechanism. This is not the only regional example. There's also in the Americas is a similar pooled procurement process ongoing. For the COVAX facility, the initial idea was under the umbrella of the World Health Organization to have one procurement for all. And actually, the high-income countries, the middle-income countries, and the low-income countries were invited to participate in this mechanism. And this would have been the mechanism for a fairer distribution of vaccines. The high-income countries, they never utilize this mechanism, with the exemption of one high-income country, Canada, which was using the COVAX facility to procure vaccines. One of the big challenges of the COVAX facility was in a market which is a seller's market. There is not enough doses. Nearly all available doses were already reserved, were bought at any cost by high-income countries. And I want to remind Mr. Swoboda, you mentioned the price. Officially, we don't even, paradoxically, we don't even know the prices, because it's not. There's no transparency on that. There's no clarity, which is very paradox. But we also know that we paid very, very high prices, because governments they accepted to accept all indemnification and liabilities, which are normally the manufacturers. And in this situation, this is now a very, very big liability. And for Doctors Without Borders, we have very, very big problems to participate in COVID-19 vaccination drives, because governments would require us to inherit the full liability, the full indemnization in case of adverse events with the vaccines. And even a big medical humanitarian organization as Doctors Without Borders, we cannot accept, we cannot carry, we cannot stem this enormous risk. So I just want to shed some light on what shift is happening, how pharmaceutical manufacturers were shifting huge costs to the taxpayers, to governments, and eventually then really hinder or make participations of humanitarian organizations in COVID-19 vaccination drives very, very complicated. For every context, for every vaccination drive, we need to clarify that we cannot acquire these risks. They must be covered very clearly, and this is we were crossing a watershed with the pharmaceutical industry. It's going to be very difficult to reverse that because this is a precedent for future deals. I just want to remind. And again, the impact is on the low and lowest income countries and people living in conflict zones and humanitarian crisis.
May just two comments, adds 2 comments. The first is on Africa in general. Mr. Bachmann mentioned some of the initiatives of the African Union. With all the tragedy we have, it is perhaps an incentive for the African Union to work more closely together and support these initiatives and develop these initiatives to a real global construction. Because Africa needs, especially this kind of health policies, they have to enhance, including also the question of production of different drugs and different vaccines, because otherwise they are left alone again. It is very strange that the genomes, the human genomes, are studied in Africa by international companies, but the research of international companies is not given to the people in Africa, but used again in the richer countries. So I think there's a real misuse of the African population to experiment, but not to give the benefits of these experiments to the people back. So that is very, very important, and I hope the African Union is taking up this responsibility. The second is on Nigeria, because Nigeria has been mentioned. Even from a very selfish position, it would be good if Europe and the West in general would have a different kind of strategy and policies. Nigeria will be one of the biggest countries of the world globally very soon. Enormous population, enormous capacities. And if we don't agree on a good cooperation and help and support, because we know that in Nigeria itself, but in many other countries, the many young people are born and they need jobs and they need development. Nigeria will be not very friendly and helpful to the European Union. Europe is still very often, the West in general, thinking that they have to be, on our side. But why should they be on our side if we are not helping them? So I think it is very important for Europe to reconsider that position. I've been again and again with the Commissioner Polainen, who is responsible especially for the relation with Africa. And I think she has a good intention and good mind and good orientation. But Europe as a whole has to do much more. And the European countries have to not demand from the Commission only more vaccines for us, but have to demand and give the money for the European budget to give more help and support to our immediate neighbors, and that the African countries.
I haven't really answered to your question, a practical example of Nigeria, just briefly, because I think it might be interesting for the audience. It happened that the same day I arrived for my work in Nigeria on March 2nd, that 4 million doses of the Serum Institute of India produced AstraZeneca vaccine doses arrived in the country. 4 million doses for a population of more than 200 million means you can cover 2% of your population at best. I must say, super impressive. How do you manage this complete lack of doses? Do you really manage to prioritize the highest and super high risk groups, frontline medical workers in COVID-19 centers, and persons with very, very high risk of severe causes of disease? And Nigeria did its best and did it well. Nigeria was planning to vaccinate all the 4 million doses in a first round, while receiving the 4 million doses to complete the immunization in the weeks later. And then happened what Mr. Swoboda, you mentioned before, that India banned the exportation of its vaccines due to the dramatic COVID-19 situation in the home country. So in the middle of the vaccine drive, Nigeria had to full stop its immunization program, and had to explain to its population, we tried our best, but we are just in the backseat of the car on this planet. Can you imagine that a European Union member state chancellor or prime minister, what rhetorics you would find if you have to address your population? I'm absolutely not in any situation to do that. And it's very important what you mentioned, Mr. Swoboda. Populations, societies in the global south, they very carefully observe how the global north, how we deal and how we live up to our promises, or we don't live up. And to many people in Nigeria they felt a kind of a retro-colonial trauma. This is something what happened constantly to us. We are exploited. We are the source of richness of the global north. Again, in a situation, there is a very, very unfair inequality situation created. And it creates for sure tensions and frustrations. And just go back to the vaccination drive, it's very difficult. How do you sensitize, mobilize people to get vaccinated when you know I don't have enough? You don't want to have 10,000 people in front of your vaccination center and you have only 100 doses. So it's incredibly challenging for the governments to manage. And now you get donations from one vaccine to another, very few doses. It's extremely difficult for the health systems in the global south to manage this erratic supplies of vaccines. And whenever I see one of these pictures, they are inflationary. Meanwhile, you see an aircraft with the air freight, and then there's the sticker of the donating country. I get furious about that, because it's addressing the home societies even including Austria. But it's very carefully observed in the global south, including countries like Nigeria, that this is again it's not even a solidary relationship. It's a very, very uneven relationship, and it's reconstellated every day, again and again and again.
Thank you very much. A very important point. Maybe the last question from my side, because there's also one in the chat, is on the topic we're having here. It's called Global Citizenship, an Alternative to Vaccination-Nationalism. So there is this concept of global citizenship, which means that we are all part of the humankind on the homeland Earth, and which of course also comes a little bit in line with this whole solidarity approach, that we are all prisoners of this pandemic, and we can only overcome it in solidarity together if we reshape our thinking and think more globally. However, the problem is very often that people then think, no, but they also think in national and in local terms. So is this concept, is there a possibility that we can shape like this more idea of a global citizenship in order also to prevent nationalistic approaches towards, be it vaccines? I mean, now it's the pandemic with Corona. I mean, there could be other pandemics, and quite importantly, and I think this is also important, that in all, at least in Europe, in all national security strategies, the danger of a pandemic has always been on top of the line. So it's not that nobody ever was aware, but it's just like the quickness with which Europe was hit somehow made us feel that we're not able to handle things. In the contrary, in Africa, we had like the Ebola outbreak, there was cholera, so they always have been like more, let's say, victims of what is happening in the world. So the question is this idea of global citizenship, can it prevail somehow? And is there a way of, be it NGOs, be it the WHO, be it the United Nations, that we somehow can put this idea forward in order to get more solidarity?
Who starts? Mr. Bachmann.
Mr.
You are a global citizen because you are from Doctors Without Borders.
Maybe in this case, thank you that you allow me to start. Doctors Without Borders, it's one of our elementary principles. It's the principle of impartiality, which includes that we don't discriminate according to nationality, to ethnicity, to gender, to religion, to political affiliation, and. It's also positively implying we are needs-driven. The only relevant element is needs-drivenness. That's the concept of Doctors Without Borders. It's a concept which is transnational, because we are an organization with the no borders, without borders in the name. The element is evidence-based, clearly needs driven to set the priorities, and this not on a national level, but transnational. Our contribution is to make the needs of people in the global south, which are very often invisible. There's hardly any visibility. It's the forgotten crisis. There's about 200 million people living in areas of humanitarian crisis who at this stage have absolutely no access to COVID-19 vaccines as we speak. So our approach is maybe a bit different, that we try to overcome this concept of citizenship on a national level. We are driven by the needs, and to be effective and efficient combating pandemics, epidemics, you always have to think globally or transnationally. It's no longer effective in the 21st century to think in national dimensions. And just maybe to conclude, what we need is concepts which support global platforms. And I'm now very curious to listen to your concept of the global citizenship, Mr. Swoboda, and I'm very curious because I think this could be a contribution to overcome this lack of really global platforms.
The former British Prime Minister, the predecessor to Mr. Johnson, once said, "Who feels at home everywhere is at home nowhere." So she was really fighting against this kind of global orientation. What we have, in fact, also look into our country, in Austria, but in many other countries as well, is a real clash between those who say we have to have responsibility also for other countries, for people in other countries. Look at the debate about Afghanistan now. And those who say we come first. Trump was, of course, the prime expressor of that slogan. We come first means only us, de facto. And I think it's a real clash we have here. It's not a clash. Maybe it's a clash of civilization, which has been used in a different form by Samuel Huntington. Now I think it's one of the biggest clash we have between a very nationalistic orientation on the one hand and a very global orientation, which is very often seen as, cosmopolitan traitor of the national idea, which is strange because, of course, nations are here. But if we have to fight for us and our interest, we have to do it also for others. We cannot travel if there is no vaccination in other countries. We have always this pressure of refugees. We have always that situation that we cannot have a good night if we know how much is thought about, for example, resources. We look to Africa again. Many of the resources we need for our electrification of our, let's say, transport system, e-mobility and so on, many of the resources are in Africa. And they are extracted from the earth in very, let's say, unecological and in unsocial ways. So again, what we did not succeed is in bringing to our citizens the knowledge and the conviction that there is one world, more than ever. Maybe the environmental issue is something which will go forward and bring forward some ideas that the people recognize. If we have a total, let's say, ecological catastrophe in Africa, it will affect us anyway. We cannot prevent it, but it's a long process. And I think that concept of a global citizenship is something we should much more think about and fight about, and convince our citizens that even it's in their interest to do more and to think more on the global issue. Every day we see it in television, global issue. Afghanistan is in all the in all the news broadcast is number one in the information. But to transform this information and this concern into something which is relevant for us here in Austria, it's still very difficult. But I think organizations like the Doctors Without Borders or journalists or Media Without Borders, they are very important, and they do even probably a bigger step forward than many of these official international organizations. So but I'm not optimistic that it will be implemented very soon. It's a long fight, and I can only honor those who, like Mr. Bachmann and others, do this fight, because it's not always recognized as important as it is, especially also in the refugee question.
Thank you, Hannes. That would have been a very good final words, but I still have one question there, and I just want to post it anyway. And someone is asking why the WHO does not have the authority to rearrange the vaccine access. It could be arranged by the United Nations Security Council, but all the council members have vaccine overstock already. So who wants to address the question on the WHO?
Well, it's also not the UN Security Council who can make a decision here. They could enhance or ask the countries to do the job. But I think, unfortunately, Afghanistan is now the bigger issue in the political debate of G7 and whatever. But as I said before, if the European Union and the US together, in this case also with China and Russia, could, at least with China, who has an internationally, globally accepted vaccine, they could do it. They could do it, and they could put so much pressure on the companies that either they suspend the property rights, or they give licenses, or they make joint ventures with those companies mentioned by Mr. Bachmann in the different countries. 7 alone are in Africa, who could produce the vaccine. So it's a question of a political will of the richer countries to do the job. Point. Nothing else. It's very easy, relatively, if the political will is existing.
Thank you. Would you like to add something, Mr. Bachmann?
I think your conclusion, Mr. Swoboda, is fully to support. There's really nothing to add. Technically speaking, the decision right on intellectual property right is up to the World Trade Organization, to the WTO, and not the World Health Organization. But that's just a footnote. And yes, the World Security Council, the UN Security Council, could be a strong decision-making body. I just want to remind that only 4 times in the history of the United Security Council, health topics made it into the UN Security Council. So hardly ever health issues, even in a dimension of pandemics, really make it to the level of the UN Security Council. And this is maybe a closing remark of a representative of Doctors Without Borders. In a world, we will see more frequently pandemics than in previous times. The brew the situation of planetary health, as we call it, it's a bit similar to the concept of homeland Earth concept, clearly indicates that events which occurred with a frequency of maybe once every 30 years or 50 years will become much more frequent. It's like with the climate change. So from my side, I would wish that we learn from the big pandemics, as I mentioned before. HIV/AIDS would have been a very, very good learning ground. The Ebola outbreak, the massive Ebola outbreak in Western Africa, 2014 to 2016, would have been a very, very, very good wake-up call. What is the impact, and it is only manageable with international coordination and collaboration, as the COVID-19 pandemic is. And I think I'm so happy that you mentioned that, and I clearly second. In the end, it's a matter of political will and political responsibility. That's where the responsibility is, and I hope that a civil society organization like Doctors Without Borders can contribute to responsibilize political stakeholders, decision makers in our spheres. And I hope that the audience, people listening to our debate, feel encouraged to do their contribution to encourage their political decision takers to live up to their responsibilities.
Thank you very much. I think that were excellent final words. Would you want to add something, Hannes?
No. Fully agree.
Let me thank you very much. It was really very good final words from you. It was a pleasure to speak to both of you. I learned a lot. Thanks for your time, and also for letting us know a little bit more about how Doctors Without Borders is working, because as you said, it's right already in the concept of global citizenship. It's no borders. It's like getting to the people in need. Thank you very much I just would also like to mention that we are still in our series are having 3 more discussions dealing with 1 year after COVID. One will deal with education and justice in education, the other one on conspiracy theories, fake news, disinformation, and Corona, and the third one on the effects on liberal democracies. You can see that all on our webpage, and thanks again also to the Sir Ustinov Institute for the cooperation, but especially thanks to you for your time, and hope to see you soon, and good luck for your further work, and have a nice early evening.
Thank you very much.
Thank you very much. Goodbye.
Goodbye.